Welcome to the Big Guy Podcast here on ACAST. We invite you to become members of ACAST Plus. Thank you.
Hello, thank you for joining us today. We're glad you made it. Here's your host of Time Out with Jim. It's Jim.
Today we are going to be talking about emphysema. I talked about COPD, which is an umbrella term for emphysema, chronic bronchitis, and asthma. So I talked to my doctor last week when I saw her, and they told me that I have a combination of emphysema and chronic bronchitis. Today we're going to talk about emphysema. Emphysema is a respiratory disease. In this condition, millions of the lungs' tiny air sacs stretch out of shape or rupture. As these thin, fragile air sacs become damaged or destroyed, the lungs lose their natural elasticity. They become unable to empty easily. Emphysema is a progressive disease, which means it continues to get worse as the condition progresses. The lungs lose their ability to absorb oxygen and release carbon dioxide. Breathing becomes more difficult. A person feels easily short of breath, like he or she is not getting enough air. Emphysema and chronic bronchitis are the two most common forms of COPD. They often occur together. Bronchitis is the inflammation and swelling of the bronchial walls. A person with chronic bronchitis typically has a daily cough with phlegm that lasts for months at a time over several years. Both emphysema and chronic bronchitis are caused by damage to the lungs and bronchial tubes. When the damage is caused by smoking, symptoms may improve after smoking quits. Smoking is responsible for the vast majority of cases of emphysema. Exposure to secondhand smoke and airborne toxins can also contribute to emphysema, though to a much lesser degree. Smokers exposed to high levels of air pollution appear to be at higher risk of developing COPD. A small number of people in the United States develop emphysema, an inherited disease known as alpha-1 antitrypsin deficiency. In this genetic condition, the body doesn't make enough of a protein called alpha-1 antitrypsin. AAT protects the lungs from damage by enzymes. When levels of AAT are low, the lungs are prone to being damaged by these enzymes. Smoking makes this condition worse. Symptoms. During the early stages of emphysema, most people will have few symptoms. This disease usually progresses slowly. Changes in breathing may be hardly noticed. A typical person will not experience symptoms until they have smoked a pack of cigarettes per day for more than 20 years. However, over time, almost all people with emphysema will develop shortness of breath. At first, this may be noticed only during strenuous activities, such as going upstairs or playing sports. As time goes on, the shortness of breath may occur with daily activities, housework, walking short distances. Eventually, the person may be short of breath for much of the day, even while at rest or sleeping. At its worst, emphysema can cause air hunger. This is the constant feeling of being unable to catch one's breath. The respiratory symptoms. These respiratory symptoms are the same regardless of the cause of the emphysema. However, two people with the same degree of lung damage may have different symptoms. One person with mild emphysema may feel very short of breath. Another person with more advanced stages of the disease may be hardly bothered by some other symptoms caused by emphysema include wheezing, coughing, bringing up phlegm, if chronic bronchitis also is present, tightness feeling in the chest, barrel-like distended chest, constant fatigue, difficulty sleeping, morning headaches, weight loss, swelling of the ankles, lethargy, or difficulty concentrating. Your doctor will ask for details about your smoking. He or she will ask how long you smoke and how many cigarettes per day. Other questions may include, do you breathe passive, secondhand smoke at work or home? Do you live or work in an area where you're exposed to airborne irritants or noxious materials? Do you live in an area with significant air pollution? Is there a family history of AAT, early onset of emphysema? Non-smokers who develop emphysema. Your doctor will also ask about your respiratory symptoms. He or she will want to know if and when you develop shortness of breath. The doctor may also wish to ask about respiratory allergies, recurrent bad colds, a persistent heavy cough. Your doctor will examine you to look for typical signs of emphysema. This may include watching for shortness of breath when you perform simple activities such as walking into the exam room, looking at the size and shape of your chest, looking at how your chest moves when you breathe, listening to your lungs for wheezing or loss of the normal breath sounds, checking your ears, nose, and throat for reasons why you may be coughing, listening to your heart, checking your skin, lips, and fingernails for a bluish tint that indicates you have low blood oxygen levels. Your doctor also may directly measure your blood oxygen level with a finger probe known as the oximeter. Checking your fingernails for an unusual curvature, clubbing, that sometimes occurs with chronic lung disease. Feeling your ankles swelling that indicates fluid accumulation. The results of this examination may be totally normal in many people in the earlier stages of emphysema. In most people, emphysema will be diagnosed by X-ray or lung function tests. A regular chest X-ray may show typical changes of emphysema. These include enlargement of the lungs, scarring, formation of holes. These changes may not appear until significant damage has occurred. CT scans are better for detecting the earlier changes of emphysema. CT scans may help to diagnose the disease in younger people or those who have never smoked. Pulmonary function testing is used both to diagnose emphysema and to determine the stage of the disease. This test is also known as Spirometry. In this test, you blow forcefully through a tube. The tube is connected to a machine that measures your lung capacity. Your doctor also may order specialized lung tests. These may require you to sit inside a glass box or slowly breathe in a mixture of different gases. Other tests the doctor may order include arterial blood gases and an EKG. If suspected, your doctor can order a blood test to confirm the diagnosis of AAT deficiency. If this test is positive, your doctor may recommend screening for your entire family. Expected duration. Regardless of the cause, lung damage and emphysema cannot be reversed if the disease is not treated. Damage and symptoms will continue to get worse, but if treated, the symptoms can improve. If you smoke, stop. If you don't smoke, don't start. By quitting smoking, you can either prevent emphysema or slow its progression. You also limit your exposure to air pollution. Restrict outdoor activity when there are reports of high smog levels. People exposed to harmful chemicals at work should speak to their employers about respirator masks or consult with a specialist in occupational medicine. If you have emphysema, ask your doctor about vaccination against the flu shot and the pneumonia shot. These vaccinations can help to prevent life-threatening respiratory infections in people with lung disease. No treatment can be used to stop emphysema, but treatment can help to relieve symptoms, treat complications, minimize disability. Doctors' top treatment advice is to quit smoking. This is the single most important factor for maintaining healthy lungs. Stopping smoking is most effective at the early stages of emphysema, but it can also slow the loss of lung function in later stages of the disease. People with AAT deficiency can be candidates for replacement therapy. This is done with infusions of natural AAT obtained from donors. This form of treatment appears effective, but it is time-consuming and very expensive. Your doctor may prescribe a number of different medications that can help to relieve symptoms, such as bronchodilators, inhalers, Spiriva, Atrovent, albuterol, Sterovent, and Fluoride. These medications are taken through handheld inhalers or machine-driven nebulizers. They create a fine mist that can be inhaled. Bronchodilators help to open the bronchial tubes in your lungs. By doing so, they reduce shortness of breath, wheezing, and cough. The Opulent, still under several brand names, is a pure form of bronchodilator because it can interact with medications and cause side effects. It is used less often than the inhaler medications. Corticosteroids. These medications help to reduce inflammation of the lung during an acute flare-up of symptoms. They also are given in pill form or by injection. Inhaled corticosteroids or pills may be prescribed for daily use. They help control the inflammation of chronic bronchitis. Combination corticosteroid, long-acting bronchodilator inhalers, glycinine and formoterol, Symbicort, Advair, Dulera. These combination products provide both anti-inflammatory action and airway opening in one inhaler. These typically are used for acute flare-up of COPD triggered by respiratory infection. Oxygen therapy increases life expectancy in people with emphysema who have below normal levels of oxygen in the blood. Oxygen usually is given through a plastic tube, nasal cannula, worn around under the nostrils, and worn under the nostrils. The oxygen may be stored in metal cylinders or it may be purified from air by an oxygen concentrator, which is what I have. A number of lightweight portable devices are available. These allow those who need oxygen to leave their homes for hours at a time. Some people with emphysema need oxygen only at night, and I only use the oxygen at night. Supplying oxygen at home is very expensive. As a result, most medical insurance companies have strict requirements to qualify for home oxygen. And my concentrator costs just below $17 a month because I got pretty good insurance. The pays the rest of it. People with emphysema also are at risk of becoming malnourished. It is important to see your doctor regularly about an appropriate diet. They are also at risk of developing psychological problems such as anxiety or depression. Counseling or medications can help. Pulmonary rehab is a form of physical therapy. It includes a structured exercise program combined with special breathing techniques, psychological support, and education that helps people with emphysema conserve energy, improve stamina, reduce breathlessness, have a better sense of well-being. Other treatments may be considered for people with advanced stages of emphysema. Lung volume reduction surgery. In this technique, parts of the diseased lung are removed to improve the function of remaining a healthier lung. Lung transplant. The transplant Usually it's considered only in people whose life expectancy is thought to be less than 2 or 3 years. When to call a doctor. New shortness of breath, a persistent cough with or without phlegm, a decrease in your usual ability to exercise, frequent respiratory infection. If you smoke, see your doctor about ways to quit. Several different types of treatment can increase your likelihood of success compared to going cold turkey. These include medications and counseling. You also should see your doctor if anyone in your family has been diagnosed with AAT deficiency. Prognosis. There is no cure for emphysema, but the condition can be controlled. People with mild emphysema who quit smoking have a normal life expectancy. Those who adopt good health habits can enjoy a fairly normal lifestyle for a long time. Even people whose emphysema is severe have a good chance of surviving for 5 years or more. The people with emphysema who continue to smoking dramatically increases the severity of the illness. It may reduce lifespan by 10 years or more. And that is all on emphysema. And remember, materials contained on here are for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately.
If this episode touched you in any way, please share it with your friends and family. And please consider donating to anchor.fm/timeoutwithjim and help keep our podcast going. Thank you for listening. And until next time, God bless you.
Thank you for taking your time out to give us a listen. And remember, become a member of ACAST Plus. God bless.